Dr. Steve here with Kinesi, and this is going to be a radial nerve gliding exercise. Now, if you have some tennis elbow or some numbness and tingling that's particularly on the back side of the hand, or some tightness in your elbow and coming down the back of the arm, those are indicators that you might have a radial nerve involved in whatever is going on. And this is a good thing that you can do to help free up the mobility of the nerve, which will make a big difference. So for this, what we're going to do is we're going to take your hand, we're going to bend the wrist back so that your palm is kind of facing towards you and up, so that your wrist is in a flexed position. But then what you're going to do is you're going to attempt to keep the elbow straight and slide this up on the wall a little bit so that you feel a little bit of tension coming through here, but you want to stop shy of where it's painful. Then we're going to bring that same side foot a little bit forward, and we're going to create some mobility from the bottom up, meaning we're going to get the hips and the pelvis moving to get the spine moving, and we're mobilizing the nerve because we've got it on tension, we've got it on a stretch, and then we're getting the rest of the body moving in different directions. We're starting with this forward and back with the hips, and we want to keep kind of turning the fingers back behind us. Then we're going to do this side to side kind of motion with the hips. So we're side bending the spine and we're mobilizing it from below, the bottom up approach. And then what we're going to do is turn the body and the hips towards and away from the wall and that arm. So here we're rotating the body in the transverse plane. And then we're going to do those same motions from the top down. So now the head and the neck are going to look down and up, and we're doing this nodding motion in the sagittal plane. And you do about 5 to 10 reps. And then we side bend ear to shoulder in the frontal plane. And as we side bend, we're opening up the spaces where the nerves are exiting. And then we're going to rotate, looking over each shoulder in the transverse plane. And again, we're mobilizing the nerve by putting it in a stretch position, and then we're moving the spine, and we're moving it from the bottom up, and we're moving it from the top down to help mobilize the nerve and free up that tissue so that it can feel better and function better. So until next time, keep moving, everybody.